on top of the fact of having a low libido or low sex drive, it's just a disinterest in not just that, it just can be everything. And you're able to lose other candidate. And then secondly, is there something in here that could be started to potentially fix all this issue? The thing with TRT is always about quality of life. It should be used to improve your quality of life, to ensure that you're having, a happy, fulfilled life, and you're extending your lives.
So, again, happy to be here. My experience, I just personally, 27 years of being on testosterone replacement therapy. So I've got a good perspective of what it's like as a patient, but also through our TRT coaching, case management. I was also acting as a medical case manager, supporting my patients in the early days when we set up the clinic. So I've got a real sense of what patients go through, including myself. So happy to be on the panel, sharing my knowledge from a patient, essentially the patient or patient to consumer perspective.
Hi everyone, I'm Dylan Gemelli. I'm an NASM certified personal trainer, nutritionist, and weight loss coach, also group fitness instructor. I have been doing hormone optimization, YouTube videos, podcasting since about 2011, and I have had the pleasure of working with several of the practitioners and doctors here, speaking with, doing podcasts, spreading as much information as knowledge as I can. And while I've worked in the influencer category, I have tried to kind of stand out apart from that. And while that may be a title, I have tried to bring some more credibility to that realm and widen it open and show that in that category, there can be real accurate science discussed and facts given, where there's not just motives or wanting likes and subscriptions and things like that, although I do, count on that for what I do. As I've grown into this and evolved into the categories, I've kind of been able to speak on panels like this, which is an honor to do, and work with everybody and kind of expand my knowledge base and hopefully provide for everybody else's.
So my name is Dave Lee. I'm a health coach, clinic owner, author in this space. I've got 3 books out on TRT, which are essentially easy to understand, affordable instruction manuals for men wanting to get their hormone replacement therapy corrected. And I'm also the part owner of 2 clinics, and these are 2 quite different clinics. One is based in Australia called Primal Zone, and it is a combination of a TRT clinic as well as a functional, holistic men's health clinic, which is very exciting to be able to offer a bit of a hybrid approach in that regard, as well as TRT Baltic, which is bringing the best of the hormone replacement therapy practices to countries where it has been previously unavailable, countries like Scandinavia, all the corners of Eastern Europe, which is very exciting as well. My primary area of interest, I've got over 100 videos on YouTube, everything from Q&As to lectures, on the nuances of troubleshooting TRT, dealing with all the most common issues that come up, as well as optimizing the entire male hormone system, so not just testosterone, but the adrenals, the brain, the thyroid, melatonin, growth hormone, getting everything working in concert properly, and ultimately helping guys get the results that they're trying to achieve from their hormone optimization therapy, which I believe is a better subjective experience of life.
Right, so welcome to today's discussion on performance enhancement with and without TRT. So we're talking about both. Testosterone replacement therapy has become a bit more commonplace in recent times, but there are still a lot of people around the world, even in the US, that don't know that it's a particular option. And I think we want to discuss from a patient-to-patient point of view what it entails. Should you be on TRT? We're at a kind of a sporting event, really, here, and you might see a lot of people. And sometimes the word TRT gets bandied about for other things, which will probably be more on the performance enhancement side. And we don't want to conflate the two, because I've actually been on not a podcast, but in the news in the UK, where they try to conflate testosterone replacement therapy with performance enhancement, which aren't the same. However, in the realms of TRT, and because of where we are, many men who have tried or started in the realms of performance enhancement and their careers are over, the natural fact is maybe their testosterone is gone. and they aren't able to recover to natural healthy levels on their own. And really the treatment for these men might be testosterone replacement therapy. And there are other men who are walking around due to environmental toxins and other sorts of lifestyle issues that are experiencing low testosterone. And just by the very nature, we know that testosterone levels are lower now than previous generations. So we would often say, your grandfather's testosterone levels, even now, are probably higher than yours in this generation especially. So we wanted to do a deep dive into kind of this topic around testosterone replacement therapy and what it means. So I think we're going to start with a kind of an obvious question, because there'll be some in society that will joke and say, those guys that don't need the TRT, haha mate, where do you get your testosterone? I get mine from my bollocks, right? Which isn't quite nice actually for some of us having that phrase. There's a psychology behind it, and because we are more than ever aware of testosterone through podcasts and Joe Rogan and these others, the question is, does everyone really need TRT? Who needs TRT? So we'll leave it to our panel to discuss.
I think if we're going to stigmatize hormone replacement therapy, we also have to stigmatize psychiatric medications. So I think the normalization of hormone replacement therapy is important. And the reason why it's important is because a lot of people every day are going into their doctor's office and they know that they don't feel as well as they should. And I think a lot of people are getting put on the wrong treatments for this. I think a lot of people are getting put on SSRIs. In the States, you guys quite liberally use antipsychotics for sleep, which is crazy. Things like inattentive ADHD, all of these diagnoses for adults, I wouldn't say all of them, but a lot of the time we're dealing with endocrine disruption, and we're dealing with the neurological and behavioral and psychological effects that come from deficient hormones. When humans have deficient hormones, man or woman at any age, you're not going to be able to thrive, you're not going to be able to do well, you're not going to be able to have a good experience of being alive. And the problem that we're dealing with in this day and age is that guys, and women actually, are coming up in their younger years with geriatric levels of hormones. And sometimes this is self-inflicted. Sometimes people have destroyed hormone systems because poor diet and lifestyle, drugs, alcohol, junk food, obesity, not doing enough exercise, these things are huge factors. But a lot of people are coming up with damaged endocrine systems from the hormone disruption that we've been bombarded with since birth. And we're dealing with the outcomes of this. And I think that when guys are going into the doctor's office with the hormone levels of an unhealthy 80, 90-year-old, and they're getting told, hey, your levels are within the range, and that means that your symptoms are just psychological, here's a prescription for Zoloft, see you later. I think this is doing far more harm than good. So the argument of, does someone need TRT or not? I would argue no one needs it. If you have zero testosterone, you'll survive, so no one technically needs it. But would a lot of people benefit from TRT? Absolutely. I think having optimal testosterone levels gives men a better subjective experience of life. It gives you a better objective experience of life. And I think that stigmatizing men who want to use it, as long as they understand that it's invasive, it's creating a dependency, there's no such thing as a free lunch. It is a treatment that does have drawbacks. But I think if a man wants to do that, to optimize his life, to optimize his outcomes, to optimize where he's going to be in the next 10, 20 years, to be a better father, to have a better career, to be a better man in whatever fields he wants to, I think anyone who's stigmatizing that needs to mind their own business. I think that that's something that if men want to do it, it's fantastic, it's bioidentical, it's health promoting, and I think that it's a fantastic choice for men to make as long as they're informed, if that's something they want to do.
Well said. I absolutely agree that in this day and age, and it's because of maybe social media, because of the acceptance that men can't feel like they can reach out, and men traditionally don't seek help and medical care, and being able to discuss this, and low testosterone can also lead to issues around mental health, and having the ability to seek out help from a doctor, not even having a, because when I started TRT, they looked at me. I was a young man. Why do you need TRT? And you just, you're trying to seek it out for some nefarious reason, which obviously wasn't the case, because they didn't understand. And there wasn't that compassion and that understanding that if you have low levels, you're setting yourself up for, potentially increased risk of early death, potentially, because the low testosterone over time will lead to all sorts of negative health outcomes, metabolic disease, not to mention, mental wellness. So, I know it's good that we're all part of the almost a community, and that we can say, look, it's okay, and you get on with life. So anyway, as a patient, one of the things I never wanted to feel like was I was a patient. This was what was needed, and I cracked on with life. And I think that's maybe others on the panel would agree.
Yeah. Well, and that's what it comes down to. It's quality of life. Okay? If your body needs it, then it needs it. It's all about how you use it and how you do it. Because there's a fine line. You can misuse anything. And I've said this a million times, more is not always better, but sometimes less can be not enough. And fine-tuning that and figuring it out is key. Now, you always need a baseline on your blood work, and a lot of people will just make assumptions because I feel this, I feel that, I feel this. Just because you're tired, for instance, doesn't mean that you need TRT, but it may. There's a lot of symptoms that you could have that could fall into a lot of categories. So that's why it's important to be very thorough in your blood work, your panels, and to find the right practitioners or doctors or clinics that you're going to go to, because some are just out for money and some actually care. One of the things that Dave said that I thoroughly agree with is things that are misprescribed. Now, unfortunately, a lot of doctors are under pressure from their insurance companies, and if they don't prescribe X amount of certain drugs, or if they do prescribe too much of one thing, they can get their insurance pulled. This is a fact. It's 100% fact. I know it because I know plenty of doctors and people that work in the drug industry that have confirmed this for me. So that's another thing that you're battling. It's a non-stop battle. One of the keys is to do your own work. Be diligent. Ask questions. Go do your own blood work if you're not getting a test that you want. It's easily accessible now. There's plenty of places that you can go do it for cheap without insurance. There's a lot of things that unfortunately people just don't know that are out there, that are outlets and tools that we can all use and do to take care of ourselves. Because unfortunately, if you don't do a lot of things yourself, nobody's going to do it for you. You go in somewhere and they're very quick to throw you on something and kick you out and tell you that you're okay, but nobody can tell you how you feel except yourself. You just have to dig deep enough into the underlying conditions and find out if that's exactly what the problem is or not. But just a question of, do we need TRT? Well, yes, some people do, and no, some people don't. Some people are too quick to jump on it, self-prescribe it to themselves when they don't need it. And some people don't realize they need it because they just don't understand or they don't know. Even though there's more education out there now, there's still not a lot. And so another problem is the bad information and sifting through. It's one of the things I battle with what I do, is I'm making videos and I'm doing these, but I can get stigmatized into a category because so many people are doing something with other motives as opposed to just trying to help people. And that's another, entire issue of sifting through things. But when we're just talking about your body and how you feel, every single person is different. What kind of dose you need for TRT? All three of us, we're going to probably need something different. Our bodies are going to metabolize different. It's going to affect us differently. One of us may be more estrogen prone than the other. We just don't know. And that's why a lot of this is trial and error and figuring out what works for you. But to stigmatize something that a lot of people don't know about, and to just make comments where people really don't have any clue, is wrong. And that's why it's important to make sure that you're looking after yourself, doing the proper research, asking the proper questions. And if you don't feel right about something, then there's a reason, and that you may need to go see somebody else to get the proper help that you need.
So we're going to wrap up this bit, but one of the things that I came across, and I've spoken about before, is the stigmatization of testosterone replacement has also come from the medical community itself. And I was on a radio podcast on the back of the article that I written, and they had an endocrinologist who was very hostile towards anything TRT. And he said, of course, men want testosterone, but whether they need it is another question, because if they needed it, they would seek a reputable source like the National Health Service, NHS, to get it, not some other clinic, which is completely unfair and unfounded, because in the UK, we have a National Health Service. So there's stigma within it, and ironically, this particular doctor did have a private clinic anyway, so he was just trying to plug for his own. So that's the thing you have to realize is, there are different players in this. Endocrinology, the ones that you would think, most lay people think, is the organization, the specialty that would treat this. I've always call them, I don't mean any disrespect, maybe just a little bit, the mediocre diabetes specialists. No, I don't mean any disrespect, but it's a fact that many endocrinologists, and it's hard to find the good ones, who will go beyond just treating diabetes. And so when you go to who you think is going to be a professional to help you, they'll fob you off, they'll say, no, I can't help you, I don't know enough about it, come back if you've got diabetes. And the fact is, if they actually cared about fixing these metabolic health issues like diabetes, then they would actually look at testosterone as a particular treatment, hence why I call them mediocre. Right, so let's see what to add to that, Dave. The next question is, a lot of people will look at the fact that at what level they'll say, okay, I don't feel feeling great, I might have these symptoms, I go to my doctor, and there's a cutoff, and they say, well, I did a blood test, and it says I'm normal on the blood test. And I think we've touched upon this before, that there are studies and projections that said, oh, well, our levels are dropping over time, we can see this on fertility, and what matches with fertility levels declining is also testosterone levels declining. But then we go to the LabCorp or the Quest, or in the UK there are other companies for blood testing, and the ranges are based on sick patients, the ones that have received testosterone tests before. They create an aggregate or an average, and then you kind of fall within that either in your age bracket or nonetheless. But certain medical boards and societies have created guidelines for treatment. Now, I don't know what your thoughts are, but what number, we can't really put an exact number on it, but in general, what number do you think people would require testosterone treatment?
That's a tricky one. Well, you could walk into an anti-aging clinic now and you could have a 500 or 600 and they're just going to prescribe it to you and sell it to you because they want to make their money. Personally, from what I've encountered over the past 12, 13 years, is that most people, once they start getting under about 400, they start to get some symptoms. Now, don't get me wrong, I've seen plenty of people in the 200 and 300s that have no symptoms, none, and you wouldn't even know it. But just, if I'm taking the law of averages on what I see on the thousands of people that I encounter with all the questions and the clients that I've had, you start getting into that, under that 400 number, you might start to see some things that go wrong, but when you get under 300, and you start getting lower, dipping lower, and you start to see that inability to lose fat, for example. You're not gaining any muscle, you're tired all the time, you lost libido. That's when I really start to see it. But and it depends on your age too. If you're in your 20s and your testosterone levels are in that 4 range, even right at 5 sometimes, there's probably something going on there, whether it's diet related, some kind of condition you may have. It's very subjective to each person. There's a lot of factors that go in there that you have to look at. There's not really a cookie cutter answer for that, but just from what you're saying and from what I've seen over all the years and from what I know through science and reason, that's generally what you start to see. But like you said, the average numbers on LabCorp, Quest, and whatever other entity wants to put out their numbers now, they're so different and they change however they want, however they see fit over time. So it's hard to comment.
So one of the advantages of working with clients all over the world is that you see labs from all over the world, and Eastern Europe doesn't update the reference ranges as often as Western countries. So in the same day, if I'm talking picomole per liter for free testosterone, which in Australia the other day I saw the reference range was 150 to 550, which is the lowest I've ever seen. I saw in Eastern Europe the same day 300 to 1300. It's the same units. So the reference range for testosterone and free testosterone, it's a simple calculation of the mean and the standard deviation of the last 100 people that they've looked at. So typically, it's sick older men with prostate issues who are having their general practitioner order them to go and get a testosterone check. Young, healthy men, well, maybe these days it's happening more so, but it's still a minority. Young, healthy men are not the average guys getting a testosterone panel check. So when we're looking at a reference range, there are some lab values where if you're above the reference range, you've probably got a problem. Some of them are useful for that. Bilirubin, which is a liver marker, gamma GT. If these things are elevated, you've probably got an issue. But the testosterone reference range is simply if you just go out to the street, if you go to the average McDonald's or the average Target, and you look out at 100 guys in that crowd, you're going, this is the average of those 100 guys. That's not a healthy testosterone level. So I find that most people do best, if we're just going to talk about putting all the units together and we're going to reference the range just for understandability. Guys tend to do the best in the top quartile of the range, all the way up to double the top of the reference range, maybe even a bit beyond if these levels keep going down. But what's important to note, and what Dylan was getting at, is age is really important. So if you have a younger guy come in who's 21, 22, he's doing everything right, and he's got a free testosterone that's in the middle of the range and it's okay, that might be an okay level for a 60-year-old or a 70-year-old. But that's not going to be the level that a young man needs to thrive and form the proper androgenic internal and psychological pathways for them to be able to develop into a man properly. It's so important that men go through a period of their life where they have this surge of androgens. It makes them want to take on risk. It makes them want to leave their mark on the world. It makes them want to be confident and develop all these really important core masculine traits. And if you don't have that, you don't have a lot to show for yourself when you get to 30 and 40 and 50 because you haven't taken the risks, you haven't gone through the rite of passage, you haven't gotten to the point where you have this competence that you're expected to have at this age and this stage in your life. So I think if we're going to look at being like, what number should a man go on TRT at, I think the numbers that Dylan was talking about are pretty good. If we're going to just draw a line in the sand, like I use picomole per liter free testosterone as my typical unit, and I find that if someone's in the low 400s or below 400 and they're having symptoms, then that could be related to their testosterone. But what I find is a good rule of thumb is there's a couple of things. One is that if they're having symptoms at a higher level, they're probably going to need to take their TRT levels a bit higher than the average guy because of their receptivity to androgens. If someone's symptomatic with a free testosterone of 400, they're probably not going to feel fantastic with a 600. They're probably going to need a bit more. So looking at where they start is important to be like, okay, if you're symptomatic here, then you might need to go a bit higher. So the first thing you want to do if you identify low testosterone is go, how can I fix this? Because if you don't fix the thing that's causing it to be low, and you take a bunch of testosterone and put it in, you're now not supporting the body, you're working against it. So if your body is naturally shutting down your levels, you need to remove whatever's causing that issue before you come in and fill it in. Otherwise, it's like your body's pumping the brakes and you're pumping the accelerator. And that's not going to be a smooth ride forward. So I think it's important to first look at going, okay, where are the levels? Are they a candidate? And then secondly, is there something in here that can be stopped or started to potentially fix or support this issue so that we're now working with the body and with the hormones, not trying to get the hormones to push the body in a certain direction.
So it sounds like, what we've noticed in our clinic, it's quite nuanced. It's not just one number. And I think everyone, doctors at their clinics might do something a bit differently. Now, just as a reference, what we found from some of the big guidelines, the British Society of Sexual Medicine guidelines, I think it goes down to around 300 nanograms per deciliter. I'm trying to convert it to say 12 nanomoles per litre is what we use in the UK. But with a little bit of thought of, well, if there's symptoms and the levels are below this number. There's an International Society of Aging Males that states in the paper that the levels is as high as 15 nanomoles per litre, so around, I think it's around 450-ish nanograms per deciliter like they use in the US might be one of the recommendations for treatment, or at least that's where you start seeing symptoms. But it's not just an outcome total. I think David mentioned free testosterone, and this is an area, not to get too deep into this, but what we find with the labs that we have, at least in Europe and maybe in the US, is the way they analyze this measure-free testosterone assay, which we found have not been reliable. So we use what they use in the clinical trials, which is a calculated free testosterone off the back of the total testosterone, the SHBG, and an albumin, and it calculates. And usually, as long as your SHBG is way off the chart, either too high or too low, then you get a really accurate level of calculated free testosterone. So we found this now, I don't know if you've seen this today, is that you can sometimes miss patients just by going off the free testosterone assay. So that's just something I wanted to add for anyone who likes to know about how it goes. But you've got to kind of pick and look at the symptoms, look at these other measures. Sometimes you look at the estradiol level is too low, and there are these symptoms. And that may explain things. And not all blood tests I mean, I think there was a study that showed, especially from the UK, the study came out and said the blood tests and the analyzers that are being used are not completely accurate. So you take several different blood tests over time. Even with basic things like hematocrit and hemoglobin, you can have variances, day to day, even running the same lab twice, you get a different level. So you've got to look holistically at the whole person. So we're going to pivot this over to some of the benefits of testosterone replacement therapy, because if you're going to go on this lifelong therapy, like, why? Why are we doing this? Yes, I've got symptoms, I'm not feeling well. Some of the doctors want to just prescribe you an SSRI, make you go away. So what are the upsides that you guys have seen? I mean, personally for me, it's gave me a new lease on life. I was quite young when I started. It was a bit of a journey, like all of this, it doesn't happen overnight, and it takes time, and you've got to work on other things. But for me, better sleep. Well, my levels got really low, and this is something that we don't always talk about, but I was getting night sweats. That's unheard of, that's terrible. And sleep is very fractured. Testosterone, that's optimized, helps that go away. So, brain fog is another one that I've noticed where you can't think clearly. And then because of testosterone also affects other neurotransmitters, you can have some anxiety, though that's, again, more complex, there may be other causes for that. Having that optimized, you feel a bit better. But it's no panacea. I mean, it's taken either years. I must have been through all sorts of different treatment protocols, which is what we're going to talk about next, but it's not always easy, but you stick with it, and over time, I've seen in our clinic, even patients, they start with one treatment, and then or protocol, they get switched to something else, you tweak it. Sometimes they can't help but wonder, if you just left them on that original treatment plan, you gave them 6 to 8 months without doing anything, it probably would have felt better anyway, because it's their body getting used to that level of testosterone. I don't know what you guys think, what are your thoughts on that?
So it depends on the person. So for instance, most people with low testosterone are going to have the inability to gain muscle. And you'll notice that not only do they have the inability to gain muscle, but they're holding on to a lot of fat. No matter how hard you diet, no matter how hard you train, nothing's happening. So when you take TRT, you got to understand you should not expect that to make you a mass monster. So people will take TRT or they'll make accusations that people take a TRT. Oh, he's on TRT, that's why he looks good. No, that's why he has the ability to actually utilize what he's doing, he or she, that's on TRT. TRT itself is not going to decipher whether you're a Mr. Olympia or a bodybuilder, but it is going to give you the ability to actually start making gains and making progress in what you're doing as opposed to having the inability to do so. Another thing that you brought up was the brain fog. So your mental clarity throughout the day and your sharpness and your focus, you'll notice with that brain fog, you'll start forgetting things. You'll start having this lack of motivation, not only to get out of bed, but to just do everyday things. Oh, I don't feel like that, or oh, I just don't want to do that. On top of the fact of having a low libido or low sex drive, it's just a disinterest. And not just that, it just can be everything in your life. It can really strip a person of their entire quality of life, their entire being. And so what I've found is that every single negative that you have with that, it will twofold increase to the positive side. It'll basically counteract that for most people as long as they're on the right dose and they're not abusing it. And they're making sure that their blood panels are okay. Some people are super estrogen prone, and even on a low dose of testosterone, they might have some estrogen symptoms, but it doesn't mean you should be just jumping on anastrozole, for example, because they write you a script for it, because that's what a lot of places are programmed to do, or to tell you to run exorbitant amounts of HCG, which me and Dave have talked about. There's a purpose for it. There's a purpose for everything, but a lot of things get misused. But the thing with TRT is always about quality of life. It should be used to improve your quality of life, to ensure that you're having, a happy, fulfilled life, and you're extending your life. If you misuse it, just like anything else, you can eat too much, you can take too much aspirin, you can take too much vitamins and have toxicity. It's just about how you use it to get what you need out of it to ensure that you have better quality of life.
Thanks for watching Balance My Hormones. If you found this video helpful, please give a thumbs up, share it with a friend, and hit the subscribe button for more TRT and HRT insights. Explore our website at balancemyhormones.co.uk for our blood tests, our free testosterone calculator, and all the tools you need to take control of your health. Together, we're making hormone therapy simple, safe, and effective. See you in the next video.